And all the participants of this distinguished guests, ladies and gentlemen.
Healthcare is often the first point of contact, and these nurses are incredible nurses today. We really celebrate and honor you.
Today around Beyond Zero, and thank you for your leadership.
She asked, whose child is going to be infected? And that's why she said, let's go beyond zero.
His partnership with the Beyond Zero initiative contributed towards bridging the gap of human resources for health towards universal health coverage.
So touching base, Janet, in regards to what you've asked, and quickly recap in our training, the training for nurses and midwives in this country.
We have listed all the 578 nurses and midwives who are the finalists. Our wonderful nurses. Please, a round of applause for them. Ngoma, Busia, Kakamega, Trans Nzoia, Turkana, Vihiga, West Pokot.
Zawadi, makofi, shangilia. Thank you.
I stand before you filled with gratitude, anticipation, admiration, and pride. I'm grateful to everybody here and the countless across the country who are watching for your tireless work to improve the health and well-being of women and children. I'm proud to be hosting the second Beyond Zero Summit to appreciate the incredible advances that your work, our collective work, has secured. It's been a journey of passion, energy, and boldness that has kept us on track since 2013. It's a special day for Beyond Zero because it gives me the honor and privilege to recognize and appreciate the role of our health workers, especially nurses and midwives, for their outstanding accomplishments in communities in which they serve. To me, you are all winners. The theme of this year's summit, increasing investment for primary health care resonates with investments we have made to help us forge stronger, more equitable, more accessible healthcare for all. I admire and deeply respect the healthcare stakeholders for the innumerable sacrifices you make on a daily basis to move our country forward. I strongly support your belief in a future where the lives of all Kenyans, especially women and children, count. The theme of the summit also reminds us that good progress has been made on all fronts, and we are well on our way towards the achievement of universal health coverage and the Sustainable Development Goals. Over the past year, we have experienced the devastating effects of the COVID-19 pandemic. As a result, we have come to appreciate the importance of a strong health system that includes a robust workforce at primary level. We continue to focus on reducing and eliminating mother-to-child transmission of HIV and syphilis in order to achieve our path validation by 2022. Our commitment towards the elimination of social injustices against women and girls, including female genital mutilation, by 2022, and ending all forms of gender-based violence by 2026 remains a priority for the government. We need to invest more in prevention of diseases and to advocate for healthy lifestyles alongside delivery of quality health care at community level. This is where the real change happens. Diversity and inclusivity remain fundamental to Beyond Zero's work. Today, we observe the International Day of Persons Living with Disability. This day has been set aside to reflect and increase awareness on the importance of inclusivity and access to services for all persons in society. Under the theme, Leadership and Participations of Persons with Disabilities Towards an Inclusive and Accessible and Sustainable Post-COVID-19 World, we are reminded of our collective commitment to do more to ensure that we leave no one behind. To this end, I urge for increased investment in registration and data collection mechanisms to advance our efforts for inclusivity. In addition, I firmly believe that partnerships are about finding ways to complement and leverage our unique competitive advantages for the greater good. It's through such partnerships that we have made remarkable progress in health at both national and county level. They include partnerships with the private sector, civil society, the media, and all citizens. To all our partners, I recognize and applaud your support. Thank you for your courage, your clarity of vision, and your commitment. As we celebrate our nurses, we all have individual stories of how they have impacted our lives, our families, our communities. Sadly, we have also lost many brave health warriors in the battle against COVID-19 pandemic. Kindly let us rise for a moment of silence in their honor. As I conclude, I extend my appreciation to you for accepting my invitation to the Beyond Zero Summit. Thank you for joining me, and may God bless you all.
We are pleased to join you. I'm standing here on behalf of my cabinet secretaries, Senator Mutahi Kagwe, who was not able to make it today, but he sends his regards. And he says that Beyond Zero Summit really is an important summit. It brings together policymakers, leaders, and key stakeholders in the health sector. And the ministry would like to take this opportunity to express its sincere gratitude for your championship for primary health care. Indeed, we can never reach universal health coverage goals without taking health closer to the people. And this year's Beyond Zero Summit objectives are in line with the Kenya Primary Healthcare Strategic Framework 2019 to 2024. And as we gather to review the latest evidence on primary healthcare investments, the role of nurses and midwives in driving primary healthcare is absolutely crucial. Your Excellency, as we reflect on the importance of effective primary healthcare on maternal and child health outcomes, we would like to take this opportunity to most sincerely appreciate the nurses and the midwives for their commitment and service in this area. Kenya has made a significant progress since 1978 when it comes to primary health care. And Your Excellency, some of the initiatives that have been taken place to strengthen primary health care include the Linda Mama program. This program has contributed to the increase in skilled birth deliveries. As an example, we've increased from 57% to 78% in 2020. And in addition, we see more mothers attending the first antenatal clinic by up to 18%. The Ministry of Health remains committed to ensure all Kenyans across the country access health, and we bring health closer to the people. As Governor has highlighted, a lot remains to be done. A lot has been done with county governments in ensuring that healthcare is more accessible for Kenyans. And of course, nurses and midwives serve as key service providers whose commitment to eliminate, amongst many things, mother-to-child transmission of HIV, promotion of maternal, newborn and child and adolescent health has been witnessed across all health facilities. And additionally, in the HIV program, again, we have made gains by ensuring that AIDS-related deaths have been reduced by 67% from the year 2013 to 2021. Your Excellency, the Beyond Zero initiative has made a major impact on service delivery for mothers and infants in the country. We are told you were alarmed by the statistics at the beginning of this journey, and we are glad to have partnered with you and to have contributed to now the reducing statistics when it comes to child mortality and maternal mortality. We have witnessed your commitment to this cause with love and admiration, the donation of the mobile clinics to counties, as well as supporting outreach programs that have promoted access to ANC and immunization services. Your Excellency, I would like to take this opportunity on behalf of Kenyans to appreciate your championship, to say you are a true shujaa, and to thank you for all the work that you've done over the past years in this program.
We are gathered here today, First Lady, not only to celebrate Beyond Zero Summit, but also to acknowledge the impact of this program on the health of mothers and children. On behalf of county governments, may I take this early opportunity to congratulate and thank Her Excellency, the First Lady of the Republic of Kenya, Mama Margaret Kenyatta, for a sustained commitment to improving maternal and child health outcomes across the nation through the Beyond Zero initiative. This initiative has been ambitious, working closely with county governments and other stakeholders to ensure that all Kenyan mothers deliver safely, their children are born healthy, and that under 5 mortality is eradicated. It also strives to ensure an HIV-free generation with zero mother-to-child transmission of HIV. Ultimately, the initiative strives to ensure that no mother should die while giving life. We hope that the initiatives currently being undertaken in Samburu County to reduce the rather high transmission of HIV from mother to child will succeed and consign this phenomenon to the dustbin of a forgotten past. County governments have worked closely with the Beyond Zero initiative since its inception. We have received support in various ways, including through the fully equipped Beyond Zero mobile clinics that were supplied to all counties. Beyond Zero campaigns and outreaches continue to take comprehensive healthcare services to communities in far-to-reach areas, helping bridge the gap between communities and health facilities. It is key to note that county first ladies joined this course and helped cascade the Beyond Zero initiatives further within counties. Today, we appreciate the role they have played in ensuring the results of this initiative reach even the furthest of places, as we have heard this morning. Some places are far away from Nairobi, at 600 and more kilometers. Initiatives like these, ladies and gentlemen, can drastically spur positive change within our communities and to contribute to much needed health outcomes. We therefore need to continue maximizing the opportunity that initiatives continue to offer across our counties. Your Excellency, ladies and gentlemen, I have watched you participate in the Beyond Zero First Ladies Half Marathon and put to test both your endurance and stamina for purposes of mothers and children. Next time, please invite me to the Beyond Zero Quarter Marathon. This clearly highlights your unwavering commitment to improving maternal and child health outcomes across the country. Indeed, your commitment on this issue was first demonstrated through the rollout of the free maternity care program, and later through your ambitions to achieve universal health coverage under the Big Four agenda. Having been a county that was piloting universal healthcare, I know the pitfalls and opportunities that universal healthcare offers to this nation. And I hope as we go forth that it was not just an experiment, but something that Kenya will implement today and beyond.